The delayed results of a large-scale coronavirus antibody study in Changhua were released on Thursday. From a sample of almost 5,000 subjects considered high risk, just 4 were found to have COVID-19 antibodies in their blood, indicating they had previously caught the virus. Doctors and health officials say this represents a very low rate of infection. After the results were announced in a much-awaited press conference, officials predicted that further studies on a wider sample of the population, including those from low-risk demographics, should reveal even lower rates.
Out of 4,841 test subjects, only 4 produced neutralizing antibodies.
The initial results from Changhua's large-scale test drive revealed that only a tiny minority had caught the virus without knowing it.
The positive test rate is extremely low, less than 8.3 in 10,000. So I want to stress again, if the rate is this low in such a vulnerable demographic, then the public at large can relax. The community is safe.
The study was conducted on 5 demographics deemed the highest risk. They are medical workers, close contacts of confirmed patients, travelers who are in quarantine, their relatives and assistants during quarantine, and those who live or work in elderly care homes.
So, if the rate is just 8 in 10,000, even among those who are likely to come in contact or be infected, then for the average citizen of Taiwan, it will certainly be less than 8 in 10,000. So that's the conclusion we can draw. But we can't completely say the risk is practically zero.
Doctors say further studies on low-risk groups should reveal an even lower infection rate. The Central Epidemic Command Center's Zhuang Renxiang was at the event and used the data to support government decisions.
Probably almost 50% of infections occur because of a carrier who is asymptomatic or pre-symptomatic. So our home quarantine and self-isolation policies are there to prevent those community transmissions from occurring. And actually, today's research confirms, in some interpretations, that these policies are correct.
Dr. Huang Limin, head of the Infectious Diseases Society of Taiwan, agreed with Changhua that 8.3 out of 10,000 should be considered a low infection rate. A high rate would look like 110,000 or 1% of the population, he said.